Hi friends, my name's Jessica and I'm a second-year doctoral student studying nursing practice. And in today's video, I want to talk about how to apply to your first nursing job. So a lot of new grads that I talk to or students in their last semester of nursing school, a lot of them stress about how am I going to get a first job? Are people going to hire me? Most of the job applications I see require experience. When do I apply? And they have all these questions and all these worries. So this video is to help you with the application process, know when to apply, what you need to apply, and what to expect. And I also want to let you guys know that below there will be a resource for you guys that gives you some interview questions to go over. It talks about certain things you should wear during an interview and just gives you some insight and tips and tricks that you can use if you are looking to apply to a nursing job. So make sure to definitely check that out if you think it'll be helpful for you. So the first thing I want to talk about is finding a job. When you should apply for a job, I would say, is when you're still in nursing school. So for me personally and a bunch of my classmates, a lot of us applied and got jobs before we even graduated. And the benefit to this is you're kind of missing that influx of tons of new grads applying to the same job at the same time, which typically happens a few months after graduation. So a lot of people graduate in May, and by the time they pass NCLEX, usually around July and August, is when employers are getting saturated with applications. So for me, I applied to my nursing job. I was graduating in May and I started applying in March and I had a job by April. And it was, the jobs will be contingent on the fact that you pass your NCLEX. So this helps employers, especially for large hospitals where there's a lot of new people coming on board, because they can get through interviewing your references, getting all your paperwork done, doing your background checks, all of those things get done beforehand, right? So all that got done in March. And then when I passed my NCLEX, it was just one of those things, call them, let them know, okay, now you start. And that kind of helps the human resources department because they're not having so many applicants all come at the same time and doing all of those paperwork. So they would probably prefer you to apply a little bit before graduation or before even passing your NCLEX. So that is when I think that you should apply. Just in your cover letter, make sure that you put when you're planning to graduate and when you're planning to take your NCLEX so that the department knows when to expect you to be on the floor and be working. So step 2 is you're going to need to create a resume. And if you guys want to check out a video about how to create a resume for new grad nurses, you can check out the video up here. I will link it above. But essentially, things that you're going to put into your resume are your education. You're going to put in your previous work experience. If you don't have a ton of work experience, you can put in volunteer experience if you volunteered at a hospital, or you'll also put in nursing skills. Some people like to put that on there. You will put in any courses that you've taken that have given you certifications. So things like basic life support, or maybe a class in de-escalation, any type of course that you've taken and gotten certified. Maybe if you're a CNA, you can put that on there. Other things that you can put on your resume are interests. You can also put in any publications or volunteer work. If you're part of a nursing association, and if you're not, you should be. Most of these nursing associations do have student discounts, and it is great to get in there while you're still a student because it offers you a lot of resources in the area that you're interested in. You have access to all the new research. They send you journal articles, and they really give you access to other nurses and people in your field that you're interested in. So it's really, really great. Sometimes they have conferences, and if you guys want to check out how to apply to conferences and get scholarships to go for free, because I did that and it was awesome, you can check out that video. I will link it above. The third thing you're going to need is a cover letter. So a cover letter is a one-page document that is introducing yourself to the employer. This is different than your resume. This is kind of like, I like to think of, is if you met with the human resources person face to face and you had your resume and they didn't know you and you were like, telling them why they should look at your resume and why you're a good fit for the job. Because essentially that's what happens. They get your cover letter, they get your resume, and they look at the cover letter. And a lot of times, some people might not even look at the resume after seeing the cover letter. They may just throw it in the trash. That cover letter is the hook that grabs the attention of the reader to be like, hey, I'm a good candidate for this position, and here's why. And if you guys want to see how to make a cover letter, you can check out this video above, and it will walk you through how to create a cover letter for your first or future nursing jobs. So the fourth thing you're going to need when applying to your first nursing job is to identify references. And it's always good to kind of have an idea of who you're going to ask to be your reference before you even start applying. And essentially, a reference is a person that the employer is going to call to ask about you as a person and ask about their experience with you. A reference cannot be a parent. A reference cannot be a friend. A reference needs to be a coworker or a teacher. Also be a previous clinical instructor. It needs to be somebody that ideally has seen you in the nursing role. So if you really haven't worked before and you have no experience, a great person would be a clinical instructor or a nursing instructor, because you really want somebody that can be like, yes, I've seen them on the floor with patients and they do great. Someone that can really promote you as a person. And typically you're going to need between 2 and 4 references for a job. So the next recommendation that I have is when preparing for an interview, you really want to think about your attire and how you're going to present yourself. And you also want to mentally prepare yourself for the interview. There is a psychology of color. So that's kind of the first part of this, is the color that you wear is going to create an automatic thought process in the human resources person or the manager of the floor or the director of the floor that is conducting the interview. It is just human nature that colors make us feel a certain way about a person. You really want to dress professionally. You want to show the person that's interviewing you that you are taking this very seriously. You show up in jeans and a t-shirt, it's just not going to portray the correct image that an employer wants to see, unfortunately. The second part of the interview is going to be the questions that the interviewer is asking you. And again, this could be the director of the floor or the human resources manager. It just depends who is conducting the interview. Typically, when you are getting hired as a nurse, you will meet with the manager or the director of the floor because, again, you have patients' lives in your hands. This is a very serious job, and they want to meet you before you are hired to work in their department that they are overseeing and running. So for interview questions, there's really a kind of base of what type of questions that they're going to ask you. They may not be worded exactly as how I put in the document below, but going through those questions in that document below will really give you an idea of how you want to answer the questions you're being asked on the interview. And what I mean is, typically in any interview, they're going to ask you about your weaknesses or something that you wish you could do better or a lesson that you learned, something that is targeting a negative attribute about you. And this really trips people up, right? Because you're in the interview, you're trying to give the best impression, and now they're asking you about your flaws. So that's kind of a tactic that they use to see how you're going to respond. However, if you use the practice questions below and you kind of go through them, you have an idea of what you're going to say. So for example, when this question comes up for me in an interview, what I usually say is that my weakness is that I like to do everything myself because I know that it will get done right. So I have trouble with delegating. However, I'm aware that I don't often like to delegate, and therefore I'm trying to delegate more. So that's something I'm kind of working on as a person to grow into the best nurse I can be. So see what I did there? I answered the question, telling them what my negative attribute was, but it kind of has a positive spin, like, oh, this person actually is a hard worker and likes things to get done right, and they're aware of this negative attribute, and they have a growth mindset. So there's a lot there, right? They asked you about a negative, but there's a lot of positives in that answer. And by preparing for an interview, by going through interview questions and kind of knowing what you're going to say beforehand really is helpful during the interview process, especially when those nerves take over. So the last thing I want to add is, how do you find a job that you want to apply for? So I really like the website Indeed. I'm not sponsored. I just really like them. There's all different ones though. There's Monster. There's like, if you just type in jobs on Google, like I think Google has their own kind of job search engine. Also, if there is a hospital that you're very interested in working in, you can go directly to their website and look up careers, and they will give you all the nursing jobs that are available right now at the hospital. So the last thing I want to add, and this is optional, this sometimes backfires, like it can work, but sometimes it doesn't work. So you just got to be aware of that, is if you really have your heart set on a certain unit or floor or position, you can also find via LinkedIn or the hospital website the nursing director of the floor, and you can email them personally. So if you apply for a job and you really want it and you don't hear anything, or if there's a unit you really want to work on but there's no jobs available, you can, and again, this can backfire, but you can email the director of the floor. And sometimes this will kind of get that person thinking, wow, this person really wants to work here. They're going to put in a lot of effort. Like, yes, they are a new grad. They might not have experience, but they're really showing a lot of initiative. Also want to be aware of the type of email that you write. It needs to be extremely professional. You need to attach your resume and cover letter. Can't just be like, hey, would really love to work there. Let me know if a job opens up. Like, no, it needs to be like, my name is so-and-so, here's my experience. I've really wanted to work on your floor because of X, Y, and Z. Maybe you had a family member that stayed there. Maybe you had a certain person in your family with the illness that this floor treats, and this is where your heartstrings are really pulled. So that's another technique you can use, but that one's optional. Sometimes you may not hear anything, but I've also known students that have done this and actually have gotten a job. So it does work sometimes. It's really going to depend on the director's personality and how they view that type of behavior. So I hope you guys enjoyed this video, and I hope that it helps you get your first nursing job. And make sure to give this video a thumbs up and subscribe below, and I'll see you next time. Bye.